Good evening all, I'm Didi Lamba with the Thursday night edition of South Asian News, Vision of Asia. We are coming to you from our studio in New York City. Welcome to the show. Let's begin by taking a look at the coronavirus pandemic and its impact. The world has surpassed 107 million cases of COVID-19 with nearly 2.5 million deaths. In the United States, we have surpassed 27 million coronavirus cases with at least 473,000 deaths. Today, the World Health Organization stated that the UK variant of coronavirus could impact the epidemic curve and could lead to more restrictions in Europe if it becomes the dominant strain of COVID-19. This, along with two other strains, are also spreading across the United States and appear to be more transmissible. On vaccine, the Centers for Disease Control and Prevention said that it has administered more than 46 million doses of COVID-19 vaccines in the country as of today and has delivered more than 68,000 doses all across. The rollout of the vaccine still continues to be slow, where many states are complaining that the vaccine demand has exceeded the supply. In politics, today was the third day of former President Donald Trump's Senate impeachment trial, with Democrats making the case for his conviction for inciting the deadly rampage at the U.S. Capitol and the former president's role in inflaming the rioters. We'll continue to follow the impeachment trial, but it's now time to begin tonight's South Asian News segment, comprising of South Asian frontline doctors and also celebrities from the Indian cinema. Here are the headlines. Dr. Lieutenant Colonel Kamal Kalsi urges all to stay vigilant and follow CDC guidelines, New Jersey. Dr. Ibbad, Yuosuf on hospital emergency rooms and COVID-19 vaccine, New York City. Upcoming Gujarat Tourism presents Film Excellence Awards Gujarati nominations featuring Sharman Joshi. It's time for a short break on Vision of Asia South Asian News segment. We'll be back shortly. And welcome back. I am Aditi Lama and this is Vision of Asia Thursday night episode of South Asian News. Let's take a look at the coronavirus pandemic's updates and measures. On vaccine, the rollout still continues to be slow, where many states are complaining that the vaccine demand has exceeded the supply. Both Pfizer and Moderna vaccines are indicating that their weekly output should pick up soon. Also on vaccine, National Football League said it was working with public health officials to allow use of its stadiums for mass vaccinations to expand the rollout. And President Biden's activation of the Federal Retail Pharmacy Program as a part of the coronavirus vaccine effort hopes to enable the distribution to retail locations throughout the country, including CVS and Walgreens. So where are we headed with these vaccines, and when do we see a sense of normalcy in the nation? On this and much more, we spoke with Dr. Lieutenant Colonel Kamal Kalsi, who urged all to follow COVID-19 guidelines. There's a huge debate going on right now about school reopenings, where they're saying that perhaps teachers don't have to be vaccinated in order for schools to be open. I'd like your comment as a doctor and as a parent.
You know, that'd be like asking me as a physician to go in and see patients without having had the opportunity to receive the vaccine. I think that's short-sighted, and I think it's important that teachers get vaccinated, and all, front-facing essential workers. I think our grocery workers, our truckers, Uber, Lyft, taxi cab drivers, all these guys, airport personnel, they're dealing with the public every day, and they need to be protected. And it's important to open up schools, but I think we have to do it safely. And while kids generally do very, very well with COVID-19, the risk is not zero. We have had kids die from COVID-19 and be hospitalized and have long-term lung damage from COVID-19. So, it's while the infection rate or the complication rate and hospitalization rate of kids is low, it's not zero.
Right. Another thing that's up for also debate right now is that the Biden administration wants to basically require anyone that's flying domestically to have a negative COVID test. What are your comments on that?
I think it makes sense. I think it's a good strategy. I believe they also made it mandatory to wear the mask at all public federal buildings and federal lands. I think that's also a step in the right direction, something that should have been done a long time ago. And it's going to take time and coordination. It's going to take the public some time also to get used to these new guidelines. The CDC is also rolling out new policies. So this is a very, very large ship that needs to be turned, and I know that our government and our leaders are working hard to do that.
And finally, my last question to you has to be about South Asians at high risk. I know we always talk about it, but what's your advice to them? And what are your concerns in general when you're looking at these individuals that have these comorbidities?
Yeah, if you have any sort of comorbidities, if you have any sort of lung issues, if you're a smoker, if you are diabetic, if you're obese, if you have any sort of chronic medical issues, I think that puts you in a higher risk category. So you should talk to your private doctor, your generalist, about getting the vaccine and signing up for the vaccine if that's possible. I know here in New Jersey there's a website and there's a phone number too that people can call to register themselves, and then the governor's office will reach out, or the health office will reach out to you as soon as it becomes available. But I think my message to everybody is to get the vaccine as soon as it becomes available, and in the meantime, just try to social distance as best as you can, and double mask, and then look to the CDC website for further recommendations. But it's really important that we stay vigilant, and we continue this downward trend, because it's unconscionable that we got to a point where we were losing more than 3,000 people a day. It just makes me sick.
Yeah, I feel you on that. Let's hope that we start losing less people and we somehow find a solution to get out of this pandemic. Thank you again for your time here on ITV Gold.
Thank you, Aditi. Have a great day.
Thank you. And we are done recording. More on coronavirus updates and measures. Today, Dr. Anthony Fauci said that the month of April will be an open season for vaccinations in the country, and most adults will be able to get vaccinated, and said that the rate of vaccination is already accelerating. He also stated that the majority of the nation may be able to be vaccinated by middle or end of summer and could achieve herd immunity. Meanwhile, we are seeing a downward trajectory in cases, hospitalizations, and deaths from COVID-19. Cases in the nation have now fallen to less than half of what they were in last month's peak, and deaths follow the case trends. However, experts are pleading Americans to not put their guard down yet. In 2021 alone, the United States has reported more than 7 million new cases and more than 124,000 deaths. And we continue to hear more about the spread of coronavirus variants in the country, threatening to bring a new surge. On this and much more, we have now another segment of our conversation with Dr. Ibbad Yuosuf on his frontline experience and COVID-19 vaccines. Here is Dr. Yuosuf. The vaccine rollout is still slow. A lot of states aren't able to figure out what to do with the doses. What have you seen in the hospital yourself? And, what are you hearing around the medical community about what's needed to speed up this process?
So as far as the medical community, I know some of my colleagues in the private sector, private family medicine offices, people in concierge medicine, other specialties outside of emergency medicine, internal medicine, family medicine, are starting to use their clinics as they're able to get federal vaccines, basically. So a lot of this is going to depend on the federal and state rollout and their ability to obtain vaccine. From there, I think, people are being very creative in their ability to get it to localities, communities, and people in the hospital, and frontline workers, teachers, public service workers, etc. Those who don't necessarily have the luxury or ability to work individually from home and isolate until they can get vaccinated.
Right.
But there is still a lot to be worked on. I know one country in Europe was actually utilizing the physical space of a bar to have nurses and workers come in and use that front space, the retail space, to physically administer the vaccine. So, you know, there's a lot of creative solutions out there. A lot of people looking for work. I think, you know, it's time that we consider as a community utilizing some of the retail stores that might be closed during a lockdown or a shutdown, or utilizing, you know, physical geographic spaces to help this vaccine get rolled out to more communities.
It's actually a very smart idea. I know they're trying to set up mass vaccination sites, but they should utilize places, you know, as you said rightly, that aren't being used right now. Just talking about the vaccine, doctor, another subject that's been, you know, up for debate right now has been the fact to do with the school reopenings. They're saying that the schools can safely reopen even without the educators, the teachers getting vaccinated. What are your comments on that? And do you think the schools are that safe to open without them being vaccinated?
Personally, I think it's you know, it's a topic that is going to take more thought than, you know, a simple question and the time that we have today. We still are learning a lot on how kids and younger adolescents and children either carry or get infected by the virus. And then, you know, you have your staff in schools, the teachers, the aides, etc., who tend to be a little bit elder, you know, in age range, that we are seeing can carry it further and get infected a little bit worse. So I think, you know, just going by the data, I don't know if it's necessarily safe to do a full open the gate kind of opening. I think we might need to look at it the way we're looking at the rest of things, and doing a tiered opening, or have, you know, kids come in for certain days of the week, and, you know, definitely have the input of the people involved in those situations, have the input of the teachers and the administrators, and even the students, the student leaders. I'm currently not in a school environment, I'm in a hospital environment, so I can't give you, you know, a full answer. I think getting those communities and those people involved to help answer some of those questions is the next step.
Right. And another topic that's concerning everybody, doctor, here is indoor dining. Here in New York City, it is set to open up, I think, by this weekend. You know, they are stating that, you know, our case numbers have been low enough for them to do that. Do you think it's safe to to open up indoor dining right now when these variants are, you know, spreading across the country?
So safe would be a little bit subjective. Like I mentioned earlier, I think we are going to have little bumps and, you know, little spikes as things reopen. I do think, you know, us as the general public needs to be understanding and aware of the fact that things might open and then possibly be closed 2, 3, 4 weeks later as we track the data. I think we have to be a little bit more open to the fact that these things are going to be fluid, and not necessarily harp on, hey, we're going to open it this day and it's going to stay open through the summer, through next year. I think that's a little impractical. So we have to kind of just watch the data and see. Do I anticipate we'll see a little bit more, you know, some more cases or another surge, or, you know, little bumps and spikes, as I said? Yeah, I do think so. Right. But we need to figure out a good way to do this as a collective, as a group.
I just have 2 more questions left here for you. You know, the first one has to do with South Asians at high risk. There's a huge number of our population that is at high risk due to diabetes, lung diseases, heart issues. What have you seen in the ER concerning those patients and COVID-19? Is there any interaction? And, you know, do you think they are at more risk of getting it?
So they're definitely at a higher risk, people with the comorbidities that you mentioned, diabetes, blood pressure, cholesterol, heart disease, etc. You know, right now, from what I'm seeing personally, is that the patients who are coming in sicker do tend to have those comorbidities. We are still seeing, there was a paper today on how patients with dementia or psychiatric illness are also at higher risk. That makes kind of logical sense medically. Patients with dementia aren't necessarily able to communicate what they're feeling and their symptoms, or, you know, necessarily show symptoms as easily patients with psychiatric illness as well. So yeah, there's definitely a risk, and with our community having a large population, a large portion of them having these risk factors, these comorbidities, I think it's definitely something to still consider. Stay masked up, still wash your hands, try to minimize interactions with some of the younger people who may have had it and who are healthy, things like that.
It's time for the short break on Vision of Asia, Voice of the Community. We'll be right back. And welcome back. I am Aditi Lamba, and this is Vision of Asia, South Asia News segment. The Gujarati film industry, also known as Tollywood, is one of the major regional and vernacular film industries of Indian cinema. The industry has produced more than 1,000 films since its inception and has brought much recognition and name to Gujarati actors, directors, technicians, producers, and more. In the last decade, there has been a push from the regional industry to reach out to the greater Gujarati diaspora and celebrate Gujarati language and performance arts. On this appreciation for Gujarati cinema, for the first time ever, Gujarat Tourism is presenting Film Excellence Awards Gujarati 2019 to 2020 on February 27th and 28th in the 10th city of White Desert in Kutch region of Gujarat. This event hopes to bring together the best talent of Gujarati film industry in a socially distanced, star-studded award ceremony following all COVID-19 protocols. We have tonight highlights from the nominations for Best Debutant Actor and Actress, Best Actor and Actress, Best Director and Best Film. Here is the story.
સૌથી નવો, છતાં સૌથી મોટો, સૌથી અલગ, છતાં સૌથી જાજરમાન, માત્ર આમંત્રિતો પૂરતો જ, છતાં મેગા ગુજરાતી ફિલ્મના અવોર્ડ્સને એક નેક્સ્ટ લેવલ પર લઈ જતો ગુજરાતનો એકમાત્ર અવોર્ડ ફિલ્મ એક્સલન્સ અવોર્ડ ગુજરાતી 2019-2020
વર્ષોના વર્ષો ચાલે અને આપણા દીકરાના દીકરાઓ પણ જોવે. જેમ સાહેબે કીધું કે ફિલ્મો મને લાગે છે પ્રોફેસર સાહેબે કીધું કે આપણે હવે ફિલ્મો તરફ વળવું જોઈએ અને ફિલ્મો આજે સાહેબ મને હમણાં સંજયભાઈની પોસ્ટ ઉપરથી એટલી ખ્યાલ છે કે ચાલ જીવી લઈએ એને 2 વર્ષ પૂરા થયા, આજે 3જા વર્ષે. તો હું એવું માનું છું કે આપણી ફિલ્મો ગુજરાતી ફિલ્મો સારી બને જ છે, પણ ક્યાંક આપણા મનની અંદર ધીરે ધીરે એ વસ્તુ બહાર એમાંથી લોકોને બહાર કાઢવાના છે ને એ કામ આપણા બધાનું છે. માત્ર આ લોકોનું નથી, ટીવી વાળાનું નથી, કલાકારોનું નથી, આપણી પબ્લિકનું પણ છે કે આપણે આપણા મિત્રોને, આપણા ફેમિલીને ત્યાં જોવા સુધી લઈ જઈએ. અને હું એવું માનું છું કે આપણે બધા આ કાર્ય કરીશું અને હવે ગુજરાતી ફિલ્મો સારા આવે છે. પ્રેમ રતન ધન પાયો વાત તમારી 100% સાચી છે સાહેબ. એ વખતના દિવસોમાં એ ફિલ્મ જ્યારે શરૂઆત થઈ.
બેસ્ટ ડેબ્યુટન્ટ એક્ટર એન્ડ નોમિનીઝ આર
ઇથાન વાડે, રઘુ સિંહજી, चिराग जानी जी, हर्षल मांकड़ हेयान युवा सरकार, निर्मित भट्ट बीजो दिवस, मोहसिन खान काचिंडो.
બેસ્ટ ડેબ્યુટન્ટ એક્ટ્રેસ નોમિનીઝ આર
शिवानी जोशी, बाबूभाई सेंटिमेंटल, रिया गौर, डैडी आई लव यू, शर्वरी जोशी, रघु सिंहजी, मनीषा ठाकर, सफलता 0 किलोमीटर, आस्था मेहता युवा सरकार, खुशी शाह अफरा तफरी.
तिहाई અને અભિલાષ ઘોડા દ્વારા આગામી 1 ફેબ્રુઆરીએ સફેદ રણના 10 સિટી ખાતે ફિલ્મ એક્સલન્સ એવોર્ડ ગુજરાતી 2019-20 ને હૃદયપૂર્વક શુભેચ્છાઓ. ગુજરાતી ફિલ્મોની ઇવેન્ટને નેક્સ્ટ લેવલ પર લઈ જવા બદલ ખૂબ ખૂબ અભિનંદન. હું આ ઇવેન્ટમાં જઈ રહ્યો છું. આવો આપણે સાથે મળીને આપણા ગૌરવને વધારીએ. જય જય ગરવી ગુજરાત.
સંગીત વિભાગ ખૂબ મહત્ત્વનો હતો, કારણ કે મ્યુઝિક એ હવે ફિલ્મનું બહુ મહત્ત્વનું અંગ થઈ ગયું છે અને અમારે એવા સિનિયર મ્યુઝિકના એક્સપર્ટની જરૂર હતી કે જે સીધા કે આડકતરા આ કોઈ ફિલ્મો સાથે સંકળાયેલા ન હોય, અને અમને મળ્યા નિશિત મહેતા. નિશિતભાઈએ પણ ખૂબ એમના જ્ઞાનનો ઉપયોગ કરીને આ બધી જ ફિલ્મોને બારીકાઈથી નિહાળી. એ જ રીતે આર્ટ સેક્ટરનું મોટું નામ અને વર્ષોનો અનેક ફિલ્મોનો અનુભવ એટલે ચીકા ખરસાણી. ચીકાભાઈ ખૂબ સરસ રીતે એમના જ્ઞાનનો ઉપયોગ કરીને નોમિનેશન તૈયાર કરવામાં ખૂબ બધી મદદ કરી. અને લાસ્ટ બટ નોટ લીસ્ટ દીપક બાવસ્કર. દીપકભાઈએ મુંબઈ બેઠા બેઠા પણ
Best actor and nominees are
रौनक कामदार, ऑर्डर ऑर्डर आउट ऑफ ऑर्डर, गौरव पासवाला, सुरतालीस धनसुख भवन, मौलिक नायक, मोन्टूनी बिट्टू, मल्हार ठाकर, गौर कैरी, प्रतीक गांधी, लवनी लव स्टोरीज, शौनक व्यास, टीचर ऑफ द ईयर, किरण कुमार, हवे थशे बापरे.
Best actress nominees are
आरोही पटेल, मोन्टूनी बिट्टू, किंजल राजप्रिय, केम छो, प्रिनल ओबेरॉय, साजन प्रीतनी थशे जगमा जीत, मानसी पारेख, गौड़ कैरी, डेजी शाह, गुजरात 11, दीक्षा जोशी, लवनी लव स्टोरीज, व्योमा नांदी, लवनी लव स्टोरीज, जीनल बेलानी, ऑर्डर ऑर्डर आउट ऑफ ऑर्डर, जीनत खान, बीजो दिवस.
હાય નમસ્તે, હું છું ફોરમ મહેતા અને મને બહુ જ સારું લાગી રહ્યું છે કે તિહાઈ ધ મ્યુઝિક પીપલ એક અદ્ભુત એટલું સુંદર મજાનું આયોજન કરવા જઈ રહ્યા છે જે કદાચ મેં વિચાર્યું જ નહોતું. એટલે મને એવું લાગે છે કે 2021 અમારા બધા જ આર્ટિસ્ટ માટે કંઈક વધારે પડતું એક્સલન્સ થવા જઈ રહ્યું છે because it is the excellence award for Gujarati people, for Gujarati artists, for Gujarati films. અને બહુ જબરદસ્ત એટલા માટે છે કે ડેસ્ટિનેશન પર પહેલી વખત એવો કોઈ ગુજરાતી ફિલ્મ અવોર્ડ થઈ રહ્યો છે અને એ પણ અમારા ગુજરાતના ગુજરાતીઓના સુપર ડુપર એક્સાઇટિંગ સફેદ રણમાં, એટલે કે ટેન્ટ સિટી કચ્છમાં અને 2 દિવસ કે જ્યાં અમારે જઈ અને નોમિનેશન્સ, અવોર્ડ્સ અને સાથે બધી જલસા પાર્ટી. સો આઈ એમ રિયલી સુપર એક્સાઇટેડ એન્ડ એની હાઉ અભિલાષજીની હંમેશા જે પણ વસ્તુ હોય છે સુપર એક્સાઇટેડ હોય છે. So I wish you all the very best to Tihai Group. અને હું પણ Tihai Group ની એક પાર્ટ જ છું. So it's super exciting for all of us. અને guys, see you there.
Best director and nominees are
विजयगिरी बावा, मोन्टूनी बिट्टू, नैतिक रावल, सुरतालीस धनसुख भवन, विशाल वड़ावाला, रघु सीएनजी, विरल शाह, गौड़ कैरी, जयंत गिलाधर, गुजरात 11, रक्षित वसावड़ा, युवा सरकार, ध्वनि गौतम, ऑर्डर ऑर्डर आउट ऑफ ऑर्डर.
and Best film nominees are
मोन्टूनी बिट्टू, विजयगिरी फिल्मोस, गौड़ कैरी, सोल सूत्र प्रोडक्शन, युवा सरकार, निर्मला क्रिएशन, गुजरात 11, HG पिक्चर्स, लवनी लव स्टोरीज, स्विस्क एंटरटेनमेंट एंड DB टॉकीज, अफरा तफरी, क्वालिटी प्रोडक्शन.
Well, this wraps up our show for the night. Please send us your suggestions and get your voices and organizations on our show. Email us on events@itvgold.com or follow us on Facebook at itvgold. You can also subscribe to our YouTube channel for free access to many of our popular shows. Thank you for joining us tonight from Queens, New York. This is Vision of Asia and I am Aditi Lamba. Take care and be well.